Hey guys, how are you? I'm going to discuss another very important topic. So, in the meantime, kindly like, subscribe, press the bell icon, and comment if you like this video. Female pubertal development. So, we are going to start with this. The girls begin the puberty at the ages 10 and 11, complete puberty at the ages 15 and 17. So, first of all, in the female pubertal development, first of all, is a breast development. The first physical sign of puberty in the girls is usually a firm, tender lump under the center of areola of one or both breast, occurring on average about 10.5 years of the age. This is referred to as a thrush by the widely used tenor staging of puberty. This is the stage 2 of breast development. Within 6 to 12 months, the swelling has clearly begun in both sides, softened, and can be felt and seen extending beyond the edges of the areola. This is a stage 3 of breast development. By another 12 months, which is a stage 4, breasts are approaching mature size and shape, with the areola and the nipples forming a secondary mound. In most young women, this mound disappears into the contour of mature breast, which is a stage 5. Although there is so much variation in sizes and shapes of adult breast that stage 4 and 5 are not always separately identifiable. So this is all the first stages of the breast development. We can move further. The pubic hair is often the second noticeable change in the puberty, usually within a few months of thrush. It is referred to as a puberc. Pubic hairs are usually visible first along the labia. The first few hairs are described as tenor stage 2. Stage 3 is usually reached within another 6 to 12 months when the hairs are too numerous to count and appear on the pubic mound as well. By stage 4, the pubic hairs densely fill the pubic triangle. Stage 5 refers to the spread of pubic hairs to thighs, sometimes as abdominal hair, upward towards the navel. Some 15% of the girls, the earliest pubic hair appears before the breast development begins. So guys, sometime some variation can happen. It means the first axillary hair can develop before the pubic hairs, or sometime the hair development is first and then followed with the breast development. So we moving further to the genital structural development, which is called as vagina, uterus, and ovaries. Perineal skin keratinizes due to the effect of estrogen increasing its resistance to the infection. Mucosal surface of vagina also changes in response to increases levels of estrogen, becoming thicker and duller pink in color. Mucosa changes into multi-layered structure with superficial layer of squamous cells. Estrogen increases glycogen content in vaginal epithelium, which in future plays important part in maintaining vaginal pH. Whitish secretions, which is called as physiologic leukorrhea, are normal effect of estrogen. In the 2 years following thrush, uterus, ovaries, and follicles in the ovaries increase in size. The first menstrual bleeding is referred to as a menarche. The typical occurs about 2 years after thrush. The average age of menarche is 12.5 years. Now this is the data of United States. Most American girls experience their first period at age 11, 12, 13, but some experience it earlier than the 11th birthday. In fact, any time between 8 and 16 is a normal. In Canada, the average age of menarche is 12.7, United Kingdom is 12.9. The first time between menstrual period is not always regular in the first 2 years after menarche. Ovulation is necessary for fertility but may or may not accompany the earliest. Associated Other conditions can change the female body shape, fat distribution, and composition. Appearing of the acne, pimples in the face, changes of the face, upper part of the neck, buttock, hips, thighs, arms, and pubis, progressive differences in the face distribution, as well as sex differences in the local skeletal growth contribute to the typical female body shape by the end of puberty. On average, 10 years girls have 6% more body fat than boys. Some other changes also can be noticed, like visual change in the odor, smell, height. These are also related with the hormonal changes, which rapidly increase the height in the women compared to the male population. Estradiol is all responsible to increase the production of phenylalanine, resulting in the characteristic of changes of the some internal vaginal organs. Thank you.